Last week, more than 15 million new cases of COVID-19 were reported to WHO from around the world, by far the most cases reported in a single week. And we know this is an underestimate. This huge spike in infections is being driven by the Omicron variant, which is rapidly replacing Delta in almost all countries. However, the number of weekly reported deaths has remained stable since October last year, at an average of 48,000 deaths a week. While the number of patients being hospitalized is increasing in most countries, it's not at the level seen in previous waves. This is possibly due to the reduced severity of Omicron, as well as widespread immunity from vaccination or previous infection. But let's be clear, while Omicron causes less severe disease than Delta, it remains a dangerous virus, particularly for those who are unvaccinated. Almost 50,000 deaths a week is 50,000 deaths too many. Learning to live with this virus does not mean we can or should accept this number of deaths. We must not allow this virus a free ride or wave the white flag, especially when so many people around the world remain unvaccinated. In Africa, more than 85% of people are yet to receive a single dose of vaccine. We cannot end the acute phase of the pandemic unless we close this gap. We're making progress. In December, COVAX shipped more than double the number of doses it shipped in November, and in the coming days, we expect COVAX to ship its 1 billionth vaccine dose. Some of the supply constraints we faced last year are now starting to ease, but we still have a long way to go to reach our target of vaccinating 70% of the population of every country by the middle of this year. 90 countries have still not reached the 40% target, and 36 of those countries have vaccinated less than 10% of their populations. WHO and our partners are actively supporting these countries to overcome the bottlenecks they face in leadership and coordination, lack of supply visibility, short shelf life of donated vaccines, limited cold chain capacity, vaccine confidence, health worker shortages, and competing priorities. WHO is also paying careful attention to the impact of Omicron on vaccines. In September last year, WHO established the Technical Advisory Group on COVID-19 Vaccine Composition, or TACOVAC, a group of experts to review the implications of variants of concern on the composition of vaccines. Yesterday, TACOVAC emphasized the urgent need for broader access to the vaccines we have, and that further vaccines are needed that have a greater impact on preventing infection and transmission. Until such vaccines are developed, the composition of current COVID-19 vaccines may need to be updated to ensure they continue to provide WHO-recommended levels of protection against infection and disease. TACOVAC also said that a vaccination strategy based on repeated booster doses of the original vaccine composition is unlikely to be sustainable. The group also emphasized that while some countries recommend boosters, the immediate priority for the world is accelerating access to primary vaccination, particularly for groups at greater risk of developing severe disease. The overwhelming majority of people admitted to hospitals around the world are unvaccinated. While vaccines remain very effective at preventing severe disease and death, they do not fully prevent transmission. More transmission means more hospitalizations, more deaths, more people off work, including teachers and health workers, and more risk of another variant emerging that's even more transmissible and more deadly than Omicron.